Hello, everybody. This is LabOPEX Live. Welcome to LabOPEX Live. We are so excited about today. We have Dr. Rodney E. Rohde with us. I'm really excited because we're going to talk about a topic that, and I'm going to ask you, you always say medical lab professionals, the heroes behind the scene. But as I say, when you talk about that and hear the name Dr. Rodney Rohde, you can't think of heroes behind the scene because he's been doing so much. I mean, especially over the past year plus with COVID, just so much. And we're going to talk about that. So for people, if you're joining us, just put in the chat where you're coming in from. We are open to medical lab professionals. We have 30 minutes, but it is so crammed with information for people who are friends of medical lab professionals and want to know more about what we do. We're going to be talking to medical lab professionals as we talk about the challenge of heroes behind the scene. And now today's topic is the pandemic, the visibility that we have now during the pandemic. So Christina Hampton, hi. Christina, we're really happy to have you. Christina is she's always with us almost every Thursday. Happy to have you, Christina. Christina, I think you're coming in from New York, right? So we're going to jump in because we have 30 minutes, and go ahead, share this live broadcast out. We are broadcasting on Facebook, on YouTube, and on LinkedIn. Go ahead and share. Go ahead and like. So we are going to first start with Dr. Rohde. Dr. Rohde, thank you so much for being on LabOPEX Live.
Thank you, Lana. It is my pleasure, and it's a privilege to join you guys. I can't wait to talk to your audience.
Okay, so like we say, we're talking about the pandemic and the visibility of medical lab professionals and the public health professionals. So we're basically saying, is this fight really behind the scenes? What do you really think? And so I want to hear from our audience. Is this fight against COVID-19 really behind the scenes when it comes to the public health professionals and medical lab professionals? Hi, Robert. Thanks for stopping by. I hope you'll spend some time with us as we're talking about medical lab professionals and the public health professionals as we fight against COVID-19. And I hope that you can learn from the medical lab community and the public health community. So we're going to just jump in. As I say, we have just 30 minutes, but Dr. Rodney Rohde, he is in the, I could say, medical lab professional and public health profession. And we just want to find out what path did he take, because he took the unconventional path to be part of the medical lab professional. He's going to talk a little bit about that. And he's also, I'm going to ask them about some of the different paths or routes that different people can take to get into the profession or even to continue in the profession. So Dr. Rohde, tell the audience, what path did you take to get into the profession?
Sure. Thanks, Lana. So, yeah, my path into the medical laboratory profession was definitely unconventional. So I went to school and obtained a bachelor's degree in microbiology, and even stayed right after that and picked up a master's degree that focused on virology, and thought my whole 6 or 7 years doing that I was going to go work in a hospital. Well, lo and behold, I left after my master's degree and started applying and realized that no one really wanted to hire me without being a medical lab scientist, without having that credential and that background. And I really didn't know what it was. And so I went to work for the Department of Health in Austin, thankfully found a job there on their microbiology bench, and started meeting med techs, right? It was med tech back then. And I started seeing, what is this? And so long story short, kind of found out about it, started looking at the working routes to get into, to be able to sit for these credentials. And so put in my time in the public health labs for about a decade. I worked for the Department of Health in rabies, virology, just loved every bit of it. I can talk public health all day, just a wonderful career path. But that whole time I was teaching as an adjunct, because one of the things you can do with a master's degree is teach. And so I started teaching microbiology, fell in love with it. Never in my life thought I would be a professor. And so it all these forces kind of came together, and I went back to my alma mater to cover a micro course for a former professor who was on sabbatical. And while I was there doing it and loving it, he said, hey, the clinical lab science program needs a kind of a microbiology specialist in their curriculum. Their main person that was doing that had retired. And I was like, I didn't even know Texas State had a clinical lab science. So for 7 years, Lona, literally across the street, College of Health Professions on one street, the Department of Biology's on the other, College of Science. Mm-hmm. And no one told me, no advisor really told me. Now, some of that's on me because I didn't really look and find out, but I also was never really told about it as a major. So I'm here to also talk about, major. You need to think about majors when you're in high school and junior high. There are so many wonderful healthcare professional majors, including medical lab science, that people aren't aware of. But long story short, they needed this person. I applied and thinking I'll never get this job. And so I always tell my students, make sure you're prepared to take a job if you apply for it, because I was offered the job. That was in 2002. And over the last 19, 20, I'll be there 20 years this coming year. Hard to believe, but I've went from assistant professor all the way up through the academic ranks. Now I'm a university distinguished professor and chair of that very program, and absolutely love teaching and mentoring and doing research with clinical lab science students. So there are ways to get into this profession the hard way. I would recommend you go to a medical lab science or medical lab technician or whatever level you want to do, because that's the fastest direct route to get into the hospital and medical laboratories.
Angela is saying, thank goodness, lab profession now has you as an educator and mentor and leader.
And Angela is a good friend and colleague of mine in New York. She is a fundamental advocate, passionate about the lab, about getting licensure in New York and elsewhere. So I want to thank her and people like her that are out there really working the trenches, to get licensure and other things passed in all 50 states.
Yes, thanks so much, Angela. And I'm going to have her on my show in a few weeks, or I think months or so, to talk about that. So that is awesome.
Great.
So I know that we have, if you're just coming on, just let us know you're here listening and watching. And if you have questions, put it in the chat. If you have comments, put it in the chat. Let us know who you are. Let us know where you're coming in from. And it doesn't matter whether or not you're in the medical lab field, public health, or friends, and you want to know more. This is a great opportunity to learn about this field and learn of what we're doing. So Dr. Rhodey just spoke about his path to get in. There's just so many paths to get in. But we probably could talk about other paths to get in traditionally. And even once you get in, what are some of the options that you have? What route can you take, for growth and career development?
Yeah, they're just, one of the things I tell my students that are coming down program, as well as their parents, which is often fun to talk about, is that our degree at the medical lab science level, but also at the entry level with MLT and phlebotomy and things like that, has a nice pathway now, because we have the The entry level, like a phlebotomist, can start there. For example, they could go get an associate's degree and become an MLT. They could continue on and get their bachelor's degree and become an MLS. There are multiple master's level programs across the U.S. where you can kind of specialize in different areas: infectious disease, SBBs, like specialist in blood banking, and so forth. And then now, even more exciting is we have a doctorate in clinical lab science, which there's 3 programs in the United States now: Rutgers, UTMB Galveston, and 1 in Kansas. So, you can go as high as you want within the medical laboratory profession, and all of those offer you just unbelievable avenues to pop around. For example, I started in public health, worked on the bench, loved everything about it. While I was there, I had an opportunity to move into a molecular epidemiologist role. So I was kind of a half and half. I call myself a hybrid professional because I was working in public health and in the laboratory at the same time. Just a wonderful opportunity that kind of cut my teeth on international and global public health pretty early in my life. So that's an awesome route. The Centers for Disease Control, the WHO. You can get into regulatory areas. You can get into teaching. I don't know how many people out there realize that our profession, right? So one of the articles I wrote during the pandemic was about us, and many people know this and talk about it. I'm not the only one. There are about 337,000 working professionals, we think, in the medical lab, and there's 330 million people out there. So we need not just people on the bench and in leadership areas. We need faculty, right? All the faculty are retiring and stepping down, and there is a really major shortage. It's getting to be a problem for faculty. So if you're out there and you're in a hospital or you're in public health and you've been working for 8, 10, 15 years and you like teaching, check it out. I mean, pick up a master's degree at least and think about becoming a CLS faculty member. We desperately need teachers.
Ask Dana about it.
Yeah, Dana is a great example, right?
Greetings, LabOPEX. Yes. So there's just so many different avenues. So people don't have to feel like they're restricted to just one thing. So based on your interest, based on your passion, I know I saw an article that you shared about public health, how we even in the lab could, and I know some people in the lab who have MPH and whatever,
right,
could utilize some of these skills or even get certification and
yes,
advanced degree in that area.
Yeah, not only, yeah, absolutely. So you can pick up degrees in public health. You can pick up credentials. There's actually certified public health credentials. You can pick up another wonderful area that I might mention real quick. Several of my alumni are doing this, and it's an area I work in with research, is infection preventionist. These are typically nurses and physicians, but the medical lab scientists, you need a bachelor's degree at least, are eligible to sit for a CIC, which is a certification in infection control, an outstanding career path where you work with nurses and physicians, typically in hospital settings, to figure out what's going on within the hospital as far as outbreaks and things like that. So IPs is what they're kind of designated as, and they're just a wonderful career path. And then one of my favorite sayings to many of my students and alumni and colleagues that have been in the field for a while and might be thinking of other things is, I would rather have someone who decides, I want to be a physician's assistant, or I want to go to medical school, or I want to go be a dentist, or whatever it is. I would rather them come from the realm of the medical lab scientist area, because what better doctor, right? What better physician than someone who actually understands the test that he or she is ordering? I mean, it's a phenomenal power to have that in your background. And that's part of why the DCLS is becoming so important, so that we can get out there, we can raise that visibility. And it doesn't just have to be a DCLS. It can be an MLS, an MLT. It can be a phlebotomist. It can be anyone who is, really wanting to interact with different types of committees within hospitals, diagnostic management teams, just anyone that can help inform healthcare. You know, we perform, Lona, 13 billion tests a year in the medical laboratory, and 2/3 of those are part of leveraging medical decisions. I mean, we are absolutely critical. We are the, you know, the backbone, is one of the ASCLS Today articles just mentioned recently from a young professional. I mean, we are the backbone of the medical world, and people need to recognize that. And it's really incumbent upon all of us to get out there and raise that visibility.
Wow. Awesome. That is so true. And I think most of us know among us, but now it's time for others to know what we
Yes.
know. And
Yes, absolutely.
so Christina is saying, what is the most important aspect that students look for in an employer when they graduate and decide on where they will go?
I love this question, Christina. This is a great question. My students are graduating in August, so I've got 20 about to graduate too. One of the things that I tell students, and even new alumni that are, you know, working their first job or two, is, you know, and maybe you've heard this from your parents, right? Money is not everything. It's important. It is absolutely important. We all need to be paid a fair wage for our expertise. However, and Lona may agree with me, you cannot put a price on the culture of your employment area. So I tell students to try to think about, when they're out there doing rotations and internships, you know, you're interviewing them as much as they're interviewing you. And you can't put a price on a place that has great leadership, that you can talk about, say Christina here wants to be involved in an ASCP or ASCLS or any other professional organization, APHL, what have you. Ask them, do you support new professionals in being not only a member, but perhaps a leader? I mean, our societies, our professional orgs need you so badly. And we need critical mass of people in there that are not just members, but are kind of willing to lead and be part of the leadership realm. So I always talk to students about that. Find out if your employer supports your professional growth, your happiness, the culture of the workplace. And of course, you know, you want to be paid well and have all those other things in place, but a little give and take on that culture piece is really important for your happiness, because otherwise you'll be looking for a new job probably shortly.
Yeah, and Christina is a very great director, and she asks good questions.
That's great.
So that's important maybe to her to know what they're looking for, so you can provide that environment. And I'm sure you have great culture and great leadership,
And
Christina.
thank you, Christina, for that question. And thank you if you're training students and doing clinical rotations for schools. That's so critically important. Well, that's a huge limitation for our majors right now in programs, as we can't find enough places to put students. So I get 40 or 50 applicants a year, and I can only take 20. So we need awesome directors like you and others out there to consider placing students. Thank you.
Okay, great. So we're going to move into this whole thing on visibility. And I know for Dr. Rody, he's been like a top voice when it comes to, especially during the pandemic. If you, I hear him on podcasts, I hear him on different radio stations, television station, all these different articles and interviews. And he's been so much of an advocate, not only for educating people about COVID, but advocate for the lab professionals and what we do in terms of testing, and for him in public health, understanding his specialty in virology and other areas. He's been such a top voice when it comes to the pandemic. So I just want to know, why is that so important to you? I mean, you've been like out there every week. I'd probably see about 3 different articles that you're behind. So why is that so important to you?
Yeah, great. That's a great question. I think it's partly, partly the leaders that I came. So I came into the medical and public health. It's been 31 years now, and I can't even name them all. So many great mentors, so many great leaders, including my former chair, Dave Fallure at Texas State. He retired last August after 45 years. And, talk about commitment. And he really, along with many of his peers, really ingrained in me early on when I became a professor what our profession was all about. I witnessed his ongoing leadership and determination around trying to get licensure in Texas, even when it wasn't happening. It was always part of his career path. And so seeing that type of dedication and passion, I think imparted a need for me to feel that accountability and responsibility to our profession. And I just enjoy it, Lona. I mean, I've always loved writing. And now what's become such a passion to me in the last 5 years, and some of your audience may know, what really triggered this for me was a TEDx talk I did for the university in 14, I believe. So I can't believe it's been that long ago. And that was kind of born out of a research slant in antibiotic resistance as well as the medical lab profession. And that kind of blew up. I was terrified, to be honest with you, but I had a great coach. Believe it or not, TEDx, when you do them, they coach you and teach you how to do it. And so I learned a lot about being on stage and doing that sort of thing. And I've always loved to teach. So I feel like I'm pretty decent at teaching anyway, but it just all came together like 6 or 7 years ago, and just fell in love with the idea of getting the word out there, and have been just passionate. It's something I enjoy. It's just something I enjoy about my career. And now when COVID hit, of course, that was an opportunity I really didn't expect to happen. My university appointed me to several multiple work groups because of all these health issues we had to deal with about masking and cleaning and everything else. And they knew that I was a virologist. So that kind of brought me on board. And then all of a sudden I started getting requests from reporters and things like that. And it just blew up, in all honesty. And to be honest, it dominated my life for about 15 months. It's just now started kind of tailing off a little bit to where I can find a little time to breathe. But it was intense. But it is something I'm so proud I did and continue to do. I tell people when they ask me about it, like, how have you been able to do that? And I'll say, it was and it still is in some ways, the most frustrating and sad time for our nation and world. But in the same way, it's been the most productive and satisfying professional year of my life. And all of that's wrapped in my students and my program and my profession. So I couldn't be more proud than to represent us.
Yes, I can't be so much proud to know that you're representing us on those big stages. And so I asked you, why was that important to you? But is this really important in general? Should it be important to us to be able to be doing things like these too? I mean, you're a role model. Should it be important to others?
Yeah, thank you. Thank you for those kind words. I'm always a little uncomfortable, but I appreciate those kudos. It is absolutely important. And it's not everybody's place to be on a stage or out front, but there are so many ways you can impact how the world knows about us. And certainly right now, there's a big light shining on the medical lab, and we need to keep that momentum through various mechanisms. One of the things I talk to my students about, and early alumni especially, and seasoned veterans, is you can be the expert. You can be the subject matter expert for your institution, for your hospital. Offer yourself. You might be surprised that a university or a hospital or a corporate lab actually has opportunities to interact with the media if you're willing to do so. If you're not comfortable doing something like this on a video or being live, then perhaps writing is something you might enjoy. If writing is something you don't like, then supporting committees or social media presence, right? We both know how important that is now in the world now. So I would say find your niche. And if nobody does it, right, I hear other people say this. We have to create our own identity, our own brand. We have to raise the visibility because it's hard enough since we're not in direct patient care, right? We have the downstream problem and the upstream problem. People don't know about our majors. They don't even know to major when they're in junior high. So teachers need to know about us. Counselors and advisors in high school need to know. You can go talk to your old high school. I mean, something as simple as that, or send emails to counselors to your old high school to tell them about this major. You don't have to send everybody to medical school in high school, right? I mean, they may want to be a medical lab scientist. They may want to be a respiratory therapist or, something else, and not just always a doctor, doctor, doctor. So, and I love doctors. I love nurses, but they have more upfront recognition. People know who they are. And so we all need to work harder at getting that word out about what we do and how critical we are.
Yes, it is so important. And I love how there's just different ways we can do it. It's not everybody's going to be out there speaking on
Absolutely.
a live or podcast, but they can write, they can be part of a committee through the associations and others. So I'm going to stop. I know we have the audience going. I'm going to read some of these comments that
Great.
Just spend some time. And before we continue, Courtney is also another lab director, and she's saying, and this was a little earlier, such a solid foundation.
Yes.
But we like when they stay.
Amen. Courtney, I could not agree more. So please know when I talk to my students, I almost, I'm almost pleading with them, to hang on and to find the right. That's why I was talking about the culture, to find the right place and the right fit for you, because we need our best and our brightest to stay put in the lab, right? It's so critical. I mean, everything we do is patient care and quality. So we need to kind of, again, that's a visibility piece. We all need to make people feel more important because they are. They certainly need a better salary. That's a whole nother show, right, Lona? We could talk about salary. It's ridiculous. We should get paid way better. That's a different topic, but we have to keep after it. And the only reason I mention those other paths is I would rather have them at least work in a public lab or become an epidemiologist or something like that with our background, but ultimately I want them to stay in the lab and become supervisors and directors and managers and all those things.
And I know you mentioned so many route that they can take even when they're in the lab. So, even at DCLS, you're still in the lab, you're collaborating with, you're advising people on the units, but there's just, the good thing is that there's so many areas, so many routes, so many paths.
Right.
So here, Ollie Bryan, greetings from the Philippines. We lab scientists play a big role during this pandemic. We perform diagnostic tests that confirm and validate the presence of COVID. And also through a series of tests, we determine the severity of the infection.
Yeah, amen. Amen. I was looking up today before this conversation with Lona, because I do this about every week or two. This is just in the United States. 470 million COVID tests as of today. That's just the US. I mean, I don't know what it is worldwide, and that's on top of everything else you guys are doing out there. So we are absolutely heroes in this past 15 years. And I mean, kudos to everybody out there that has done that work, has stepped up and fought through your weariness and your frustration and your depression of having to work 7 days, 12 hours straight. I know a lot of my alumni are really tired. And so I hope everybody is getting back into somewhat of a normal routine, but depending on where you live, it's still a big issue, especially in certain countries right now, like India and elsewhere.
Yeah. Thanks so much, Ollie Bryan. Thanks for all you're doing. And he is also advocating so much for the profession. So thank you so much.
Thank you.
Christina, I think we were talking about she being a great director. Need more student in New York. Okay. on your visibility, some of the things that you've been doing, Dr. Rowley. I think that's a compliment to you. So Yolanda is saying, so I fully agree that the grassroots work to spread the word, but that is a hill that's too steep to climb alone. How will the professional organization amplify our voices?
Yeah, that is a great truism, Yolanda. I mean, we can't do it alone. I know some people feel like they are doing it alone. I guess the only thing I would say is that organizations like ASCLS, ASCP, APHL, and numerous others that are in those subcategories like microbiology and hematology and blood bank and so forth, all of them are trying to amplify that voice. Membership is important, getting involved and help lead some of those types of committees and social media. I mean, that's what I've gotten involved with ASCP and ASCLS, and as well as ASM for microbiology, is I've tried to become a mentor and a worker bee, as well as a speaker and writer around us, right? And so one of the things, Yolanda, that I really wish we could find a way to do it, it costs money. And so that's part of the issue, right? Is I wish we could find a corporate sponsor or three that has helped, like nursing, right? So like Johnson & Johnson, or somebody comes in and they do commercials about the medical lab. Wouldn't that be awesome? Just a commercial, a 30-second commercial that pops up during the Super Bowl or whenever. That's probably too big of an ask for money, but just in regular programming, I think it would be so helpful to have some commercialization of what we do. And that's just one thought. I don't know if it'll happen, but that's something that I've been trying to figure out with different organizations. And then just trying to hang in there and find your own voice, and keep moving on. But you can't do it alone. You absolutely cannot do it alone.
Love that. So, jump into one of those organizations where there are others like you that you can work together.
And if you don't know where to jump in, reach out to me. I'd be happy to shoot you. If I don't know, I'll send you to the right person that can give you some opportunities with committee work and things like that, to kind of help in these areas. There's social media teams that help amplify our voice and things like that, if that's something you're comfortable with.
Yes, definitely. Send us a DM and yes, we'll direct you in the right direction. We're going to jump one last question, which is really, really important. And we advertise, it's like what part the medical lab and public health profession played in this fight against COVID. And how did that bring visibility to the profession?
Yeah, I talk about it a lot, and I make the mistake that people know what it is. Public health and medical lab, they're both in their own ways kind of in the shadows of healthcare, which is another phrase I like to use sometimes. So, public health is really the overall ability for the United States, for example, to not only detect new agents of infection, but to use surveillance to monitor them. So right now, the most important thing public health is doing, and we're fighting for congressional funding to be better and ongoing, is to build up our surveillance capability. And by that, I mean genomic surveillance, right? So we need to know where all the variants are popping up. We need to know their prevalence and incidence in certain communities and countries when they enter the U.S. And before this pandemic, this may frighten you or surprise you, but our public health system was not well funded in some of these areas. So we were only sequencing probably around 1% to 2% of all isolates in the U.S. That is pathetic. And to be honest with you, other countries were outpacing us in this area. So right now, with more funding and more attention, public health is now getting, with university labs and reference labs helping them, they're getting up around 4 or 5%, and our goal is to be 10%. So that'll actually create jobs and more workforce, because you need public health funding to do that. Of course, the medical lab is on the front side of the battle, right? So they are in the trenches doing, that immediate turnaround. The key for a medical lab is just to know, is it positive or negative, right? So that treatment can start and that you can move forward. But the way they work together is that the public health, I always talk about public health as kind of it's kind of the Facebook of the, you read about it later. They do stuff later.
Mm-hmm.
Twitter is more like the medical lab. It's like, give me now, give me now, give me now. So, I mean, it's really about what's needed to go up front, which is immediate testing to treat patients. But then all those isolates from all over the country have to be looked at with respect to genomic mutation, what's happening out there. And this is not just about right now, right? I mean, we need to be prepared for the next issue, the next outbreak, because there are many agents that, I'm watching African swine fever right now and some others that are doing some havoc in other countries. So there are lots of things to watch and be prepared for. And public health has to be part of that as well as the medical lab.
It's a lot that even initially, that when COVID hit, there's just all these other things that happened at the lab. Say, for instance, the clotting, and you end up having hematology involved when it comes to different testing like the dimer, and
Right.
it's of course molecular became like such a big thing. We ended up building like a whole new
Right.
lab.
And the other problem, Lona, that, and again, this, you probably have done shows on this, I've done it with some other groups, is the staffing issue, right? I mean, this pandemic shone a big old light, excuse me, put a big old light on us with respect to our shortages.
Mm-hmm.
And it was crazy because some labs, because they shut down all the elective surgeries, they were laying people off. That's crazy, because they didn't have the ability to ramp up to do nothing but COVID testing. Whereas other labs could ramp up, but then they couldn't find enough people to run the lab. I mean, it was bipolar. It was one way or the other, and it was just crazy. So, and then the whole issue of travelers, right? So people were so desperately needing people that they would hire an MLS from Texas to come to, Montana or someplace and pay them 3 times what they get in Texas. So of course people are going to leave. And that creates some problems. It leaves vacuums of experience and vacuums of manpower in different areas. So there's some lessons that we need to learn and some things we need to look at for future issues like this.
Yeah, how we structure
You're right.
our staffing, and when it comes to cross training
Right.
and preparation for, because you should be able to move people from one area to support another area instead of closing one area.
Right. It also shines that light on, what I'm very passionate about as well, which is qualified, licensed, or certified laboratory professionals. We shouldn't have legislators and other leaders going, well, let's just get whoever to do this test. No, absolutely not. I mean, again, I love nurses, I love other people, but they don't have I don't want to set a Foley catheter. I'm not trained to do that. I'm not licensed to do that, but I need people that know and understand quality laboratory testing and how to troubleshoot when the machine's not working, or an assay's not working, and understand clinical cutoffs. And I mean, there's just so much that people don't realize. Again, people don't understand in the public of how valuable we are. So it's incumbent upon us to get that information out there in a way that people understand, right? We need to find better ways to communicate.
Yeah, Yolanda, let's see. Yolanda is following up on what she said. I don't think she doesn't think that's a great idea. It's a suggestion because she's thinking it's costly. Okay.
Yeah, I mean, I tend to agree with you about a full blown media campaign. Again, and again, this is just history and it's the truth. For example, ASCLS used to have 40,000 members. We're struggling to keep 6 or 8. We just don't have the funds. And so we need membership to grow. And I mean, there's a lot to unpack there, right? But I do think we're healthy. I am most excited about new professionals and alumni and people that I'm working with across the country that I'm mentoring. They want to do something, right? They're very motivated, all with the whole political activism you see going on. And it's not just young people, it's people that are just fed up. So I hope that we can take this and really leverage the pandemic for that type of activity.
Okay, so I think she's saying it's not that expensive, actually. Yeah, so I think once we come together, there will be, like different perspective, new ideas. It's really good to come together, as we were saying, association, collaborating, coming up with different ideas. Someone may come up with one idea that may not be as totally effective, but somebody will come with something else that could just make some modification to that. So it's important for us to collaborate with different ideas to come up with solution to this problem. And when we're talking about fighting this, the big subject was not just being those heroes behind the scene, but Dr. Rodi is, like I say, a great example of someone that's fighting this pandemic in a very visible way, bringing so much visibility. And I'm really, really proud of that. And I think that so many people can learn from this, not just necessarily going out there to speak, but just doing different things in your own ways. um, Association, if that's not where you want to be in the schools in terms of um, educating students at an early stage. For me, I had no idea what medical lab professional was throughout high school. I was told you should go to medical school. So, and I think a lot of our stories are similar. So I think we
Right.
have a lot of work to do, and we see where it's possible. And that's why we bring different people on the show who are doing a lot, doing different things, not necessarily in the same way. And Dr. Rodi is a great example when it comes to bringing visibility. And that's just one of the many things that we can do for our profession. So I'm so grateful. I'm so thankful for this show. And I think Yolanda and you will have some really great conversation.
Yeah. Yeah. And I want to thank, Lona too, because what she's doing is also part of this media campaign. So thank you for what you do. And I do feel your pain, Yolanda. I really do. Believe me. I know exactly where you're coming from. I've been doing this for 20 years in the medical lab and 30 when I throw in public health. And it's a long journey to get there, but we do need to find ways. We absolutely need to find ways to be more PR savvy and to find some ways to spend money wisely and to get the right people in place. So I wholeheartedly agree with you, and I hope that you will continue to be part of that fight with us. So thank you for everything you've done in the past, and I hope you keep working with us.
Okay, thank you so much.
Thank you.
You, the guests, been like putting in so much questions and engagement, and thank you so much for being here. We're doing this every Thursday, Lab OPEX Live. Thank you so much, Dr. Rodi. I mean,
Thank you.
so invaluable, like what you've been doing and what you continue to do, and the show today. Um, Please share this out. I usually ask for you to like it so that it activate the social media platform so other people can learn from this. So share this out, like it, so other people can benefit. And thank you all. Thank you so much. Have a great evening, and I'll see you next Thursday.
Thanks, everybody.